All right, guys. Today's NCLEX question answering strategy is assessment first and answering by the nursing process. This approach emphasizes using assessment as the priority and applying the step of nursing process it by, also known as assessment, diagnosis, planning, implementation, evaluation, to guide you in selecting the most appropriate action. Many unclear questions are designed to test your understanding of the correct sequence in nursing intervention, with assessment almost always being the first step. Okay, so um, one, you want to assess first, right? Do not jump into intervention prematurely, right? One of the biggest pitfall in unclear question is moving directly to intervention without assessing the patient condition. Many questions are structured in a way that encourages you to act immediately. But remember that assessment usually comes first unless the question clearly describes an emergency requiring immediate action. You understand? Um, let me re-say it again, right? Assessment always comes first, except if you, when you read your question, it clearly states to you that this involves an emergency uh case, right? Then you jump to intervention. Example question right here. A patient on a post-operative unit is complaining of pain and nausea. What should the nurse do first? Like right now, anytime NCLEX asks you what should you do first, they want you to follow either a step or the nursing process. 100% guarantee that way. But the only reason why you might jump a particular step to another step, as I said, it's depend on that particular scenario. If it look like an emergency situation. So when you read this particular question, does it look like emergency situation to you? No, right? No. So what should we do first? Even though A is telling us that we should give anti-nausea medication, but sometimes you can even still critically think and be like, if I solve nausea, what about pain? Right? So if I am solving nausea and I'm not solving pain, do you think A will be the correct answer? No. We don't really want to notify the physician because we need to do something first, right? Except if the issue is really concerning that it's only the physician that can solve the situation at that point, right? Offer comfort measures such as repositioning can solve the pain, it might not solve the nausea, right? So let us really look more deep into why the patient is having pain and nausea by doing C, assess the patient pain and nausea level. This is just um me explaining it without strategy. But according to the strategy, right? Anytime you have a question that asks you what to do first, always think about, is the question asking a certain step? It's just like right now, they might tell you about a particular procedure and what should you do first. You know, you are carrying that procedure right from what you should start with first according to that procedure. It can be performing hand hygiene and all that, right? That we follow. But right here, you can see they are testing the nursing process, right? So assessment always comes first, except if it's an emergency situation. As simple as that. So even though novice can easily answer this question if they follow the strategy, right? Now you can see that's the answer C. Now follow the 8-5 process: assessment, diagnosis, planning, implementation, evaluation. Though nursing process guides most NCLEX question, right? Let me give you the breakdown on how you can use it. Assessment, the first step in nursing process, assessment involve gathering data about the patient condition. Diagnosis, you use that those data to identify the problem or potential issues, right? Your planning is now you creating a plan with goal and outcome. Implementation, you are taking action based on the plan. Evaluation is the evaluation of what you have done, right? You evaluate the effectiveness of the action and determine if the goal were met, right? When you are faced with multiple choice, think about which step of 8 pi are you in? I always tell my students all the time, think about that. In most cases, assessment will come first unless the question require you to evaluate or implement based on the priority assessment. Like if you look at the new generation NCLEX, most especially the case study, right? Each of the 6 questions is written in a sense that you will get to a place that they will tell you to implement, you'll get to a place they will tell you to evaluate. So you know you are not doing anything assessment at that point, right? Because the question require you to either do evaluation, implement, you understand, or think about what plan will be done for that patient, right? So example question right here, a patient with history of congestive heart failure report sudden weight gain and swelling in the leg. What should the nurse do first? So ask yourself, they told you the patient is reporting weight gain and swelling in the leg. As far as I'm concerned, I'm not seeing any emergency situation right here. So I can easily decide to assess more so that I can find out if there's something I need to be worried about right now. You understand? So let's look at the option. We have document the findings, assess the patient lung sound and edema, C, administer a diuretic as prescribed, D, encourage the patient to limit fluid intake. B would be a correct answer because that is the way I can see if there's going to be something I need to intervene with right now. Imagine I listen to the lung sound and there's problem, then I know I need to intervene now. You understand? So B, assessment, right? I hope you guys are getting the concept because this is how the NCLEX exam is being put together. And most of the time, you need to understand so that you don't have to think too much when you answer some question on the NCLEX exam, right? Because there's a lot of information you need to process when you're answering the question. So having the right coach, joining the right program will help you out. That's why I encourage you to join my program so that you can have idea on how you can be able to answer different question on the NCLEX exam and then have less question to critically think about. Okay. You number 3, know when to skip straight to intervention. And I told you, I've repeated it many times. You only skip straight to intervention when it's emergency situation. Repeat after me, emergency situation. While assessment is typically the first step, there are exceptions, right? Because a lot of them will be like, oh, but I saw they said we should assess. I thought assessment was the correct answer. I selected it and I got it wrong. Yes, you are getting it wrong because there are exceptions, especially in life-threatening situation. You need to identify if it's a life-threatening situation where immediate intervention is necessary. In these cases, the correct answer may involve a direct action that stabilizes the patient before further assessment. Right before further assessment. Example question. A patient with history of anaphylaxis begins showing sign of swelling in the throat and difficulty breathing. What should you not do first? You can see right here, swelling, meaning the airway is gradually blocking, right? And we need to we can't even start to be doing assessment because airway problem can kill the patient. So what do we have to do? Right? We need to administer epinephrine as ordered right here. You understand? Because that is the first line intervention for what the patient is experiencing. We cannot start by checking the blood pressure. No, the patient could die while we are doing that. Right? So B, because this is an emergency situation, right? So great. Now, for apply assessment to delegate safely, right? In delegation related question, the nurse often need to delegate tasks to others on the healthcare team. Assessment, evaluation, education are nursing responsibility that should not be delegated to UAP, unlicensed assistive personnel. Always perform an assessment before delegating tasks, especially if the question involves a change in the patient condition. right? So example question, you are a charge nurse on a busy unit. Which task is appropriate to delegate to a UAP? We know we don't want to give them assessments. So obviously we can take out D, eliminate D. We don't want to tell them to educate. So we can take out C, eliminate C, right? We as well don't want them to do any form of monitoring, which is as well evaluation, right? So we are left with assisting the patient with ambulation to prevent fall. B, yes, they can definitely do that. There are more critical ways to analyze questions like this, but I'm just giving you the most easiest form, right? When you join my program, you're going to get the more clinical way to address questions like this, because you need to know more than strategy to tackle most NCLEX delegation questions, because they might not come that easy right here, right? They might tell you about a patient that require assessment, but they will not tell you assess the patient. So it's now you that will not critically think that does this patient require assessment? If they do require assessment, then I cannot delegate it. If this patient require monitoring, it's just like right now they said assign a UAP to a patient that just uh took their medication for so. You know they need evaluation. That kind of patient cannot be delegated to the UAP, right? Or newly admitted patient. They say, okay, patient with new diagnosis, newly admitted. You know they will need teaching, education, all that. So you cannot delegate that. So it's not necessary that the NCLEX is going to put educating, assessing, monitoring. They can just hide it in a scenario sentence and then you have to figure it out. You understand? So you get questions like that and teaching about that when you join my course. So if you want to join my course, stay till the end of the video. I'm going to tell you how. Now you can see the answer is B. So now, five, choose option that allow you to collect objective data. Very important, right? Very important. So now, in questions where multiple assessment options seem correct, go for action that provide objective data that can help guide further intervention. Look for options that measures vital sign, observe physical symptom, or quantify data. Example question. A patient is reporting dizziness and lightheadedness, right? Which action should the nurse perform first, right? Provide the patient with juice. B, instruct the patient to rest quietly. C, check the patient blood pressure. D, document the patient's symptom. Now, you know you want to like do assessment. So obviously you are going to look for assessment first because these don't look like emergency situation. So easily I can say C is the correct answer, right? C is the correct answer. But let me just give you a little bit tip on the more clinical way you can go about it. This does not have anything to do with strategy. It's just to think about it. What's the patient experiencing? Dizziness, lightheadedness. Will giving juice solve the dizziness because you don't know what's wrong with the patient? Do you think giving juice might solve it when you don't know what's wrong with the patient? No. Asking the patient to rest quietly, there might be more to the patient needing rest. You understand? There might be more. There might be problem that you need to know before you can say, okay, maybe there's no too much problem. Rest is better at this point. You understand? We don't know, so we cannot easily tell them to rest, right? So that's one aside. Now, checking the blood pressure can be sign of maybe low blood pressure. You understand? Like when you are critically thinking, you might say, okay, dizziness, lightheadedness, can it be low blood pressure? Can it be? You understand? You are thinking a lot of things to find out, okay, why are they reporting this? But you don't know that's the reason why you want to check. Document the patient symptom without not doing anything is wrong, right? So C, correct answer. Now, six, don't confuse assessing with diagnosis. I do tell my students all the time, don't confuse assessing with diagnosis, right? And you are going to understand what I'm trying to say now. In the NCLEX question, remember that assessing and diagnosis are separate steps, right? Some people feel like when they have assessed, they already know the diagnosis already, so they don't think about the diagnosis. Assessment is just the data. Diagnosis is the from the data you can tell what is the diagnosis, right? So always let's go through the question first. So your role as a nurse, right, is gathering data rather than making medical diagnosis. Be careful not to jump to a diagnosis without performing initial assessment. That's what I'm trying to say. Now, if you see a patient complain, don't think because you because it's only because you were in nursing school you understood that complaint as a particular diagnosis. So don't quickly jump to the intervention. Because you understand that if you were new to that particular problem, what would you have done? You would do your assessment. So because you were in nursing school and you can be able to identify that that particular problem complaint align with a particular condition does not mean you jump into intervention first. You still, like now, look at this example question. The patient is complaining of chest pain. A lot of students will start saying it seems they're having MI, heart attack. You understand? So they go to options that speak to the diagnosis or intervene to the diagnosis. Now, some people might select A is the answer. They might say, okay, assume the patient is experiencing heart attack because that is what they think about chest pain. But the truth, real life, is that we need to do assessment first, right? By assessing the patient pain characteristics and taking the vital signs to be sure. Because the chest pain might not be MI, it could be any other thing. It could be pulmonary embolism, it could be pneumonia, it could be TB. Any other things can cause chest pain. It could be trauma to the chest, right? So always don't confuse assessment for diagnosis, okay? So the answer is C. Now, 7, prioritize assessment to identify risk and need. I can't say this enough. Prioritize assessment to identify risk and need. When answering questions that involve risk, fall risk, infection risk, assessment is vital to identify need before implementing preventive measure. Recognizing risk through assessment allow you to plan effectively. Example question, right? We have a new patient with a history of confusion, dizziness admitted to your unit. What should you do first? We have confusion, dizziness. You understand? Only this cannot make us create a judgment. We need assessment, guys. We need assessment. So we need to find out what's going on. And obviously, you can see option C, assess the patient level of confusion and gauge stability, right? Because this is like a sign of it could be a neurological issue, all that, right? So assessment. The whole gist of the strategy is just to let you know if they're asking you what should you do first, always think about is it are they trying to tell us to answer a particular procedure, the step, or they are trying to ask us to follow the nursing process? The only reason why you skip assessment first is when it have to do with emergency situation. Know that, guys, right? Know that because it's going to help you out. And most of the time, the question might really point you to intervention when they might tell you most important, most effective. You understand? They might be pointing you to jump assessment straight to intervention. Read the question very well to understand. But what is going to make you know if you are going to start with assessment or jump to intervention or evaluation is whereby you understand if the question is something that need more information or if it's a question that need emergency response. Okay. So yeah, the answer is C. In summary, always assess first. Always prioritize assessment unless the situation is life-threatening. Follow ADPIE. Use the nursing process to guide each step and select the most appropriate action. Theory responds to emergencies with intervention. In clear emergency, intervention may take priority over assessment. 4, use assessment when delegating. Avoid delegating assessment, evaluation, education to UAP, right? 5, gather objective data. Prioritize options that allow you to collect measurable data. 6, don't diagnose. Focus on gathering information without making medical assumptions. 7, assess the uh, identify risk. Assess patients to identify risk factor before implementing safety measures. So, guys, if you need my help in passing the NCLEX exam, right, DM me right now on Instagram, and I'm going to I'll be checking my messages and I'm going to get back to you on my program, right? So, thanks for watching this video, and I will see you in my next video. Bye.